Thank you very much, Tanish, for joining this interaction after 5 month marathon journey of most easiest journey in my career. I have given this comment to mom also. कि Tanish kind of client I never get, and you have been the beautiful soul, not only as a person, as a client also, who keeps supporting me throughout the journey. I tell to my teammate also, कि we never get client like Tanish, and it is not something appreciation, Tanish. It's a true value. If you can check this with your mother. How many time I have said this? कि I am privileged कि I could meet Tanish. Tanish has been always supporting, always listen, never argue, which is the most common thing in people with OCD. They keep trying, telling, validating, कि no, what I'm doing that is correct. So this journey of transformation belong to your own personality dynamic, which were already correct since you came a moderate level of obsession related with subject. And the subcategory which you used to have, arranging, ordering, color, number, pattern, perfection, checking, rechecking, multiple theme, but most of them are around moderate. And all these categories, especially color pattern, number pattern, alignment, perfection obsession, people usually doesn't come up for uh, addressing their OCD issue. So let's start this question answer to document your uh, journey with us. I will be asking few questions. Your answer will help other sufferer who are just looking for their turn overcoming OCD. So just for audience, Tanishq is a finance background professional from Switzerland, basically from India, but settled in Switzerland. So this is for those who think boundaries can may become a reason of access to care. But the reality is, Tanish is one of them who is from the Europe. Right now, also we have a different part of the world client, three from US, one from UK, two from Canada, one from Dubai, one from Norway, one from Mexico, and recently another person joined from London and around the India also. Most of the part of the India people access then online mode. Though we have a other two modality or model of care also. One is a on-site, complete on-site as a 4 week, and then mixed model. So, Anish, this discussion is for helping people to have a trust to initiate their initial journey with us, so they can build a trust of first 1 month experience. So, Tanish, my first question: how was your life before joining the Emotion of Life program, especially related with OCD? How the OCD was impacting your day-to-day life? If you can share some.
So, so I was aware that I had OCD and that there were elements of my life that were negatively impacted by some of the unnecessary obsessions that I had with doing things perfectly and doing things in my way, and just not being fine with somebody else doing things for me because I wouldn't be fine with their quality.
Mhm.
And I do think that I was recovering gradually, but if I had to be more functional and if I had to speed up my own um, recovery journey, I did need external support from a medical professional who knew what he or she was doing and was able to guide me in a
Mhm.
good light.
Yes, so what we have observed, Ananta, is that is the one learning for me also. Even if somebody take a time, let's say I remember you took around 7 to 10 days time before after the consultation. So what was your mindset before joining this program after the consultation? Is the gap in between consultation to the opting program, those 7, 8, 10 days, what was happening? So you took a time to the starting the journey.
So I think there was a general lack of ownership and responsibility to
Mhm.
act on certain things
Okay.
because I didn't think it was as important.
Okay.
I knew that I was recovering,
Mhm.
um, but this would mean further commitment and it would mean further discussion, and I would have to spend time doing it. So initially, I wasn't as willing to go the extra mile. But that's
Yes.
exactly what was needed.
Absolutely. So I remember your mom play a crucial role connecting with us. She had a word twice before your consultation. So that is another level of support I get from your mother throughout the journey. She was always in communication, keep guiding us also with a small input, which was very important for me. So Tanish, just for understanding how the client see the journey. So how your recovery journey start with us and what made you to choose Emotion of Life OCD recovery program? If you can recall, okay, what was those things that make a decision making effort?
So I was consulting other psychologists and therapists before Emotion of Life too,
Mhm.
and I knew that I was recovering. But in a way, I guess I was forced into this
Mhm.
journey
Mhm.
by my parents, which proved to be a good decision. But they wanted me to go a step further and to try something where I would have to push myself and show up again
Mhm. Mhm.
and
Mhm.
again.
Correct.
And I think that's exactly what sped up the recovery process too, because you're engaging in more discomfort with respect to what you like to do and what you don't like to do.
True, true, true.
Um,
Understand. So, Tanish, what was the turning point when you felt recovery is possible? Like when you start with us, what was the point when you feel, okay, yes, I can also reach to my complete recovery? That turning point or the time when you realize, okay, yes, I'm going in the right direction.
I guess so, as I mentioned before, there was gradual improvement coming, but the fact that I wanted to take accountability and ownership
Mhm.
um, as I kind of kept attending sessions and listening and working with you and some of the other assistant psychologists and therapists, I
Mhm.
think there was a gradual willingness on my part and more maturity in my part to say that it's time that I get things in order and that I become more productive and a more functioning and contributory member of society as a whole.
Correct,
So
correct.
I guess it came from a an attitude shift. And I kind of saw it work the most when uh, when in December, over 20 days, I did more work than I did over the past 3 months. So the
Mhm.
fact that I was able to push myself and I saw the importance of things
Mhm.
and I acted on it kind of gave me reinforcement that I am uh, becoming better.
Correct, correct. So I believe you highlight in between the journey this connecting daily as a model of care as a OCD recovery program also help you because most of the professional do once in a week or once in a 2 week interval. So that tempo loss. So does this daily session help you?
Yes, I do think the daily sessions help. I think that's exactly what's needed
Correct.
because in order to do daily sessions, it does cause discomfort
Mm.
because even if it's just showing up, it's you have to push yourself sometimes
Correct.
to show up. And there were multiple times when I didn't want to show up because I was just a little tired and I didn't want to maintain the consistency. But if
Mm.
you have to change the way the brain works and change these obsessions, you have to push yourself in those systems of discomfort,
Mhm.
um, where you have to act differently
Mm.
and gain more from that conversation.
Perfect. So, Danish, just for my understanding to keep evolving this program, I'm doing it for last 24 years, just modifying, trying to put the best possible modality, which can make the journey easy, super smooth. And you have been the one client in our life who has showcased this. That the journey can be completed without much trouble. So, how was emotion of life approaches for this OCD recovery different from what you have tried earlier? If you can remember anything, what make us different from the others?
I think what really helps is if somebody is able to tie in their life experiences to what's currently going on in your life, and if somebody has seen a slightly harsher version of reality and has had to work through life problems, because that's essentially what happens when you develop an obsession of some sort. You don't want to address something that needs to change. You don't want to go through that unease and discomfort. So if you have somebody whose mental framework and psychological framework is strong and is able to tell you that there's a lot worse that's happening and that this is just another waste of time for you and it's not something that really helps you. Doing something fun could be much better than obsessing over something like this.
Correct, correct, correct.
I think that reality check is something that's quite important.
Correct. So now I wish to have a feedback for me. So how has been your experience with me as a lead therapist, and how has been your experience with this special model of care where we assign a four-person team for a one client? So one as a me as a lead therapist, and then one assigned psychologist in your case as a co-therapist. So two people serve you. I guess Muskan serve you, Shivani serve you, and then the wellness coach also come up in picture for a few sessions if you remember. So how this, what is your opinion about me as a leading this journey, and then how this multiple specialist team help you?
I think it's nice to have a four-person team know exactly what problems you're facing, and the fact that you have multiple people from that group within each call really gives them the opportunity to assess for themselves where I'm standing, where I need help, what else I need to do, and so on and so forth. So I think the best part was the just the agility of responses I would get from you was really good. You pretty much respond within a couple of minutes at the
Uh-huh.
max, no matter when you're texted.
Correct,
So that's something that's something to look up to because knowing myself, sometimes I take hours, if not days, to respond. And sometimes you do leave out just the basic things because they're easy, but they're very important.
correct,
So I
correct.
think just that proactiveness that I saw from the whole team was something that really helps. It's
Correct.
like the team is on their toes, so they expect you to be on your toes.
True, correct. And that is what we teach. Let's be prompt. And for about me, I also have obsession of responding on time. So if I'm more than 2 second delay when I receive message on WhatsApp, I feel bad. The message comes, what I want, let's say some message came at 1 p.m., 1 minute, and I don't want to make it 1 p.m., 2 minute. I want that message should go abruptly on spot. So person should
Yeah.
feel that there is somebody who is always available, and that is for everyone, whosoever. Let's say new person or somebody with the reaching to cure state 5, 10 years before. Not only client, their caregiver, and whosoever drop a message. So this I have a habit. I have my own reason of responding quickly. So thank you very much for this input. Okay, you acknowledge it, and that help a lot to the building the trust in client and family member. So same approach I have for a family member also. I never take a minute also to respond. So, Tanish, how you will describe your overall 5 month journey now? Right now we are in follow. So, any few line for your this 5 month journey?
I think if I were to describe it in a few uh, sentences or in a couple of sentences, I would think it is an intense journey that forces you to address your problems head on. And it's something that also gives you support while doing while taking those steps to make sure you're feeling better.
Correct.
And I think just the tying it to people's daily lives and adding humor to it is something that really helps in the entire recovery process.
Correct, correct. So, Tanesh, if I ask you just another simplest question. So, how is your life today compared to the before you starting this recovery process? So, what things you find is a better, which you can highlight and share for others? These things and you could change and upgrade.
I think um, compared to before, there's a lot more clarity, focus, maturity, and a work-driven attitude that I have now,
Correct,
as opposed to in the past.
correct.
I think now I'm willing to do something that I find a little boring or something that I find a little tedious. I'm
Mm,
willing to take the first step now and just get it done and over with
true.
because it's really the simple, easy, administrative type tasks that tend to be the most important. That when you put to the side, then you have to do 10 more steps to accomplish the same. So I just think there's an environmental shift
Mm,
towards um, using your time better, which is something that has shifted tremendously over the past 4 to 5 months.
thank you very much for this input. This will help me also. So, Tanishq, if I wish to ask, how has recovery improved your confidence, your relationship with yourself and your ecosystem, and especially your future plan? So, what are those differences you can easily feel?
I think with respect to confidence and relationships, um, firstly with confidence, I think there was more anxiety in the past
Hmm.
because I knew that things I needed to do that were very simple, I wasn't doing because I just didn't feel like doing it or I felt a little lazy doing it.
Hmm. Hmm.
Nowadays, I put the laziness aside and I do the job just
Mm.
because it needs to be done,
Mm.
and it's critical.
Correct.
And I think when it comes to it also bleeds into relationships because if you're living with your parents like I am now, they do also have a sense of worry about
Correct.
it.
Correct.
And when the worry comes, then they ask you more, and then that can also lead to more frustration. So it's a cycle.
Mm.
So when you kind of address the root cause, which is exactly what the emotion of life process helped me, then the worry level drops and there's more relaxation in the atmosphere around you.
Mm. Understood. Thank you for this input also. So, Tanish, if I ask you, how will you describe emotion of life, OCD recovery and cure program? What is your comment? Just a one-line statement.
I would say it's a good and supported reality check.
Hmm, hmm, correct. So we also believe it allow person to have the reality check instead what they think about themselves and about their OCD and the negative picture worldwide people see when they are diagnosed with the OCD as a word. So what would you say to someone who feel their OCD is too severe to recover? Because most of the people have that mindset. My usually people when come first they say my OCD is extremely difficult, more complex. Everybody is trying to prove
I
my
think I think what people really need is somebody who's had it tougher than them
true.
and who still made it work
Correct.
to
Correct.
call them out on their inability to manage their own life.
Correct. Correct.
If some cases are naturally very complex, in which
Mm.
case, you have a doctor that's helping you, so that's good. But in a majority of the cases, you just need somebody to tell you to stop whining and cribbing and crying about unnecessary problems.
Correct. Absolutely correct. So, according to you, Tanish, I believe when you have interacted other client also, I guess two, three client you have made in past during your journey. So, what do you think and how important is the client mindset, their own discipline, way of living and coming for session and their commitment toward their recovery. So how this mindset, discipline, and commitment in recovery process might have helped you and
So,
might help to others. So that would be one message from your side because I have seen the next level of commitment in first 4 month. Fifth month, I saw that you were in a academic going for a German classes, so there was some session missing. But first 3 to 4 months, it was a completely bang on target, daily coming on time. So what do you think? How a message for being disciplined, motivated, and committed toward the recovery can change?
so I think it's very important to be disciplined. I do think I still have some work on with respect to not being chased. Sometimes people do have to chase me a little bit, and that's still something I have to improve. I think the last month I was a little more, I started to actually do more. So sometimes I felt if I was in the middle of it, me taking a class meant I had to get my mind away from it. Maybe it could have still been a good choice, but I was doing something productive, and I think that was the good part as a whole. But I think the showing up and the consistency, as much as it is frustrating also because it's just annoying sometimes when you're in that recovery path
Mhm.
and you know you have to once again do something that is a little tougher on the mind
Correct.
to make that choice. I do think it's important because once it's done, and then you don't have to look at it again.
Mm.
So I do think it's these mentality shifts are very important because if you don't do it, then you're not able to do an act of service to yourself first and
Correct.
foremost.
Correct. Correct. Absolutely correct. So thank you very much, Anna Tanish, for these valuable input that will change someone's life. When people will be watching this video, your one word, one line can transform their life. Just the last question to help people based on your experience. What is your recommendation advice about emotion of life, about me and my OCD recovery program? Because around the world, what we see, there is a number tell 240 million people around the world which have been who has been given this message as a death sentence. You will remain with OCD lifetime. You will have to take medicine always. Complete recovery will not happen. You can manage only. But you have been such a person along with thousands of our other clients. Recovery is possible if you are committed to it, and anything, everything can be achieved. OCD is a one simple subject. I remember I have shared you multiple client scenario without disclosing their identity. Ki what was the level of problem they used to have? Let's say I remember
Hmm.
I was discussing with one lady from Bangalore, 40-year-old, who used to bath for 8 hours, 50 time hand washing. And she transformed her life in a 7 week in online, coming here Agra in 2 weeks. And from that, those 2 weeks changed her perspective completely. 8 hour bathing converted to the 12 to 40-minute bathing and 50, 60 time hand washing. That is also 10, 10, 15, 15 minutes. Now, 3 to 4 time hand wash. That is also 20 second, 10-second hand wash.
Yeah.
So what is your message for people who are just thinking, exploring, trying to wasting, exhausting their time in medical medicine, and then don't have a hope? Means people, I have seen people with a 30, 20 year of struggle taking medicine, keep talking about the medicine, but so what is your
I
message based
think
on your
I
experience?
think the my message would be to stop reflecting, stop thinking so much. Find support like the one Emotion of Life gives. Put yourself in uncomfortable situations and start acting to make your life better. Because unless you do that, your life will stay the same.
Correct. So what I use in my practice whenever people comes, I use this in a one line. Same mistake, same outcome. If you want a different outcome, you have to react and think in a different manner.
Yes.
Thank you very much, Tanish. It's pleasure to be part of your life for 5 months. This journey will continue. We will be connecting back again on a weekly basis for next 6 more months. So you reach to your cure state, and this OCD become just a history in your life. Thank you very much.
Yeah.
We'll connect next week again. Uh, Thank you.
Thank you.
Can I see that this thumbs up from your side also? Thank you very much.
Yes.
All the very best.
Thank you.
Thank you.